process to activate payments on the travel portal and to also upload their test reports on the NCDC portal. As a follow-up, the Kano IBM International Airport, Enugu, is ready for reopening. A date will be announced in due course after a few logistic issues are cleared. The Presidential Steering Committee has also reviewed the travel protocols for diplomatic travelers, and the Honorable Minister of Foreign Affairs will brief this media on the steps that have been taken so that as much as possible we have a seamless process when it comes to protocols that are required for diplomatic travelers. Today, we are privileged to have the Deputy Head of Mission and other members of the American Embassy who are graciously donating over 4 billion doses of Moderna vaccines to Nigeria. We thank the government and the people of the United States for this gift, and we promise that it will be utilized judiciously. Also important to note is that every state of this country now has at least one U701 ultra cold chain equipment to store ultra cold vaccines. So we are ready, and we have adequately provided cold chain storage facility in the 36 states and the Federal Capital Territory to host and house these vaccines. Before I call on the Honorable Minister of Health, followed by the DG, Nigerian Center for Disease Control, and the ED, National Primary Healthcare Development Agency, and the technical head of the Secretariat, to give us their technical updates for today, I want to use this opportunity to cede the floor to the Deputy Head of Mission, who is leading the delegation from the United States Embassy to make their presentation, and thereafter we would continue with the technical segment of this media briefing. Thank you, and we thank you so much for the generosity of the government and people of the United States to the people and government of Nigeria. And as I said in my address, we want to assure you that these vaccines will be judiciously used and timely so that the efficacy and the need to vaccinate our people is done in a very rapid way so that we can get the population prepared to be able to push the numbers. So far, we have just vaccinated about 2% of our population. And to get to herd immunity, we need to get to 60 to 70%. So we have got a long way. But this generous donation that is coming from the government and people of the United States will go a long way, along with other sources of vaccines that we are procuring and also receiving. You have details of the vaccines that we are expecting in the months of August and September from the Executive Director of the Primary Healthcare Development Agency at the appropriate moment. Thank you, and wish you a very pleasant evening. Thank you.
Very much, the Secretary to the Government of the Federation and Chairman of the PAC. It affords us an opportunity now to invite the Deputy Chief of Mission, Embassy of the United States of America, Kathleen Pittsburn, to the platform.
You can pull it down.
Should I come over here?
You can pull the microphone.
I'll help you with that. You know, we are not.
Can I see me? Okay. All right, thank you and good evening. I actually watch these press briefings actually pretty religiously, so I'm very excited to actually be on the other sides of the microphones. So thank you, Honorable ST GF for the invitation. And I'm here with many friends, the ministers. Okay, thanks. The ministers of health and foreign affairs, ministers of state who I've worked with for 20 years, Dr. Faisal, Dr. Chikwe, a lot of doctors, Dr. Mukhtar, we're full of doctors. So I'm really delighted to be here, and I'm very excited to introduce you to our team at the U.S. Embassy, including Ann Patterson, who's the country director for USAID. And then we have Mary Boyd, who is our country director for CDC, Centers for Disease Control. And sometimes I feel like Peter Hawkins from UNICEF is actually also a member of the U.S. Embassy team, given how closely we work with you. The reason that these individuals are here and why they're so important is because overall the U.S. government has provided over $73 million of assistance to the various parts of the Nigerian government for this response, and each of them oversee about 65 individuals in my embassy who have also participated as technical experts, supply chain experts, etc. So we've been with you, and we're going to stay with you until we see this to the end. So I wanted to bring them along so that they can get some credit for their excellent work. So we're so proud to have been able to donate 4,080,000 Moderna vaccines to Nigeria. A lot of this comes from the fact that we've been such good partners for a long time, but in the health field in particular, it's probably one of our strongest relationships that we have, whether we're fighting different other diseases like HIV, malaria, tuberculosis, etc. What we found here was a true partnership in the health field in fighting COVID. So we know, Secretary, that you will be using these vaccines, and we have very full confidence in the fact that the Nigerian government can deploy them, get the jabs in the arms, as people say. So we're with you to the end to see this through. The cold chain, I know, is a big challenge, but I think this will help us with some other vaccines that will be coming in. I'd like to really again thank Peter Hawkins from UNICEF, who's been the logistical support for us and the other diplomatic missions in terms of bringing in vaccines through COVAX, working very closely with your team, with Dr. Faisal's team, and with Dr. Chikwe. So the U.S. is really committed to getting the world out of this pandemic, and that's why the Biden-Harris administration has increased the numbers or the amount of money committed to bringing vaccines throughout Africa and the rest of the world. So many of you may or may not know is that this is part of our $2 billion commitment to bring vaccines. We helped pay into COVAX for the AstraZeneca that arrived in March 2nd, and there was other shipments of Pfizer and J&J that will be coming through that we have also, with our other donor partners, to fund. So we feel this is very important because ending the pandemic is something everybody in the world has to participate in together, and if we don't do it together and we don't ensure that everybody reaches herd immunity, we're going to be wearing these face masks and practicing non-pharmaceutical interventions for a long time. So we would like to get out of that business if we can. So through our particular agencies at Post, I know that we are able to make sure that the vaccines get rolled out properly. We've worked with you on ending polio here. We have a great supply chain and great work that we're doing on HIV/AIDS. So I think that this is going to be just yet another thing that we're doing in partnership. So I just want to leave you with a few words from President Biden, who said that the United States is committed to bring the same urgency to the international vaccination efforts that we've demonstrated at home. And as many of you have seen, in the United States, we have some states with very, very high vaccination rates. And that's what we'd like to see here in Nigeria, is to work closely with you to get the same type of vaccination rates here. That's going to depend on all of us to really overcome vaccine hesitancy. And so I really urge anybody who has not been vaccinated to get a vaccination. It's the one thing that you can do to protect yourself and your family, protect your community, and protect other Nigerians. And if we don't all do this, we're never going to see the end of this pandemic. So I'm going to leave you with that challenge. And I want to really thank the Secretary and others for allowing us to be here to share the good news with you. So 4,080,000 doses of Moderna. So get ready and get jabbed. So I'll leave you there.
Thank you very much. We now move back to our usual format. The Honourable Minister of Health.
Good afternoon, everybody. The Secretary to the Government of the Federation and Chair of PSC, honourable ministers here present, our guests from the U.S. Mission and UNICEF, Directors General and Executive Director, ladies and gentlemen of the press. Like many parts of Africa, Nigeria has begun to record a sharp increase in the number of confirmed COVID-19 cases, especially since this month of July, as global anxiety over the Delta variant spreads. All data indicate that we are now no doubt in the third wave, the resurgence of SARS-CoV-2 infection, which we saw coming since it first appeared in India. As of today, Nigeria has recorded about 174,315 COVID-19 cases out of 2,542,261 samples tested, with 7,151 cases active and sadly 2,149 fatalities. I wish to use this opportunity right away to again solicit more participation of our states in the roles that they have to play at this very trying time in sample collection, preparing isolation and treatment centers, providing logistics for movement of commodities, supporting vaccinations, especially by providing resources for those who are conducting vaccination, and finally reporting to the various COVID-19 pillars. Only 17 states made data or sample submissions in the last cycle, and there were Lagos and Akwa Ibom states were turning out to be the epicenters. But there are others. We have about 8 states of concern right now. I shall come to that a little bit later. Of particular concern is that the Delta variant spreads more rapidly, 60% more rapidly, and has become predominant in many countries, being presently responsible for over 90% of COVID variants infections in the United States. It is also less discriminatory in the people it affects with severe illness, whereas the previous variants we saw mostly affected those who are above a certain age of 60 and also who had pre-existing illnesses. The Delta variant is known to be less discriminatory. It affects people, it has affected young people and even children. I therefore wish to renew my call to all Nigerians to improve on observance of public health measures and non-pharmaceutical interventions, because they are the best, the simplest, the cheapest, and the most reliable means of protection we have to date if we are to continue to prevent the widespread of these variants. I want to add to that all those who live in the states that have been mentioned as those of concern should voluntarily reduce their travel, should stay more at home, because the more we move around, the more the risk of transmission and carrying this virus to places where it did not exist. So unless you have a really strong reason, I'm advising that all people stay in their homes or stay in their state until we can see better. These states are Lagos, Oyo, Rivers, FCT, Kaduna, Kano, Akwa Ibom, and Plateau. We're asking for cooperation not to travel for leisure at this time, except it is absolutely necessary. We're also considering strategies to scale up testing and to identify cases for isolation and treatment. And I want to ask that if you feel unwell, especially if you have a fever or you suspect you might not be well, visit the nearest testing center, visit a hospital, and get a COVID test. Less than 10% of beds in our treatment centers are occupied. So we still have a lot of oxygen supply, it's assured. And as we continue to build up our oxygen capacity in our country today, we are going to be having well over 60, 70 oxygen plants in the country. And we are going to make sure that they are widespread out. Places like Warri, Kontagora, and places that are not necessarily in state capital, we have an oxygen generating plant in the State General Hospital. And I want to urge governors of these states to begin to prepare the state-owned general hospitals to have oxygen plants. In addition, we shall have 12 liquid oxygen tanks that will be distributed as reserve for major teaching hospitals where we need a backup of that type. To strengthen home-based care among those who are COVID-19 positive but have only mild or no symptoms, we have developed a training manual for home-based isolation and care, which includes mental health and psychosocial support. This manual can also be useful for those who are in quarantine. The Federal Ministry of Health is engaging resident doctors who have embarked on an industrial action from this morning with a view to quickly resolving the issues. And while this is going on, all medical directors at federal and also state hospitals are hereby directed to ensure that service delivery is not disrupted in their hospitals. The vaccination in Nigeria should resume very soon. As we all know, we had to end it on the 9th of July when we ran out of vaccines. But thankfully, with the arrival last night or this morning of 4,080,000 doses of Moderna vaccines, thanks to our friends in the United States of America. The vaccines are undergoing necessary validation by NAFDAC. Nigeria would have received 40 million doses by the end of the year, and the National Primary Health Development Agency is up to the task of applying all of these and shall commence the distribution to states as soon as the certification for use is prepared. I wish to implore all eligible citizens to present themselves for vaccination as the best way to preserve your life, your health, and your livelihood. Evidence from our treatment centers show that most of those with severe illnesses or the deaths from COVID-19 are those who did not get vaccinated. This is the same evidence, as a matter of fact, in other countries. It's also been observed that where infection occurred, among those who were vaccinated, it came with very mild or no sign of illness. It is therefore in our interest to be vaccinated. It's also a moral responsibility because it protects not only you, but should be protecting your loved ones and your colleagues and all those you live with. We hope that by the time we have achieved our target of 70% or more vaccine coverage, we should all be able to breathe easier from the threat of COVID-19. Thank you for your attention.
Chair of the Government of the Federation, Honorable Ministers, DGs, my colleagues, Deputy Head of Mission, and your team, thank you very much for the very kind donation to the country. So just following on the comments of the SGF and the Honorable Minister, in the last few weeks, after holding down the number of infections in our country for about 3 months, we've begun to see an increase in the number of cases. Many people ask, why is that the case? I think the question that I'm surprised about why that hasn't even happened earlier, given how relaxed we've become in terms of our response. But the fact is that we're now in the third wave of this outbreak in Nigeria. Having said that, cases are predominantly in a few states, but as we know, we are an interconnected country. People travel, and it's very likely that very soon we'll see increases in other states. The data shows that right now in Lagos, 1 in 10 people that we test turn out to be positive, a test positivity ratio of about 10%. Same in Akwa Ibom State. The national average is 6%, but it varies really from about 1% in many states to about 8–10% in a few states. Given our relationships, travel, it's very likely that with this virus, if we don't take specific measures, we'll see even further increases in the number of cases. People also ask, is this because you're just testing more? No, actually, we are testing more incrementally, but I think the detection of the increase in cases in Akwa Ibom, in Oyo, in Rivers, actually is a demonstration that our surveillance system is working. The investments that we've made over the last 2 years in setting up a surveillance architecture for COVID has been able to identify these increases in the few states where this is currently happening. In addition to just detection of cases, we've also built up our genomic sequencing capabilities, which has led, unfortunately, to the situation in Akwa Ibom State, where right now 80% of all the recently confirmed cases have been confirmed to be the Delta variant, which means that transmission is likely to be a lot more intense, and we have to redouble all the efforts that we've been making to contain the spread of this virus. So it's even more gratifying that in addition to the tools that we had already, we now have 4 million new doses of vaccines to work with. As viruses evolve, it is in their nature to mutate. And as transmission continues, it is likely that new mutants will continue to emerge unless we are able to contain transmission. To understand what is going on, how they're mutating, where they're going, who is getting infected, that is why we have surveillance systems. And surveillance systems start from those that collect samples, to the labs that test, to the higher level labs that do the sequencing, to the colleagues that do the analysis and presentation. And with that knowledge, we provide our policymakers the information they need to make very hard decisions. And I'm sure that data will feed into the data our colleagues at NPA-CDA will now use to define how the vaccine allocation will work across the country, taking into consideration where the burden of disease is at the moment. But the reality with the Delta variant is that it is much more transmissible. But the good thing, too, is that the vaccines have been shown to provide protection against severe disease, hospitalizations, and deaths caused by the COVID-19, including the Delta variant. So the vaccination that we'll get will really help us mitigate the impact of this virus. So really my appeal to all Nigerians is, in addition to everything we've been saying, to limit exposure, limit involvement in mass gathering events, parties, weddings, going out at night to clubs, wherever the gatherings indoors, especially with a lot of people, that exposes you to increased risk. And with this new Delta variant, it doesn't take a lot for you to get infected. Many other countries have learned the hard way, so we have to really push hard to not go through those experiences ourselves in Nigeria and mitigate the impact of this new variant in our country. So as the ED of NPACDA will elaborate on in a few minutes, the plans to distribute the vaccines in Nigeria, the vaccines themselves will not solve all our problems. We don't have enough to go around, so if you do have access, please go. If you don't, please continue doing what we need to do. If you're not yet of the age that is being recommended for vaccines, please manage the risk to yourselves and your families as much as we possibly can. A lot of activities in young people who don't necessarily get ill, but of course transmit the virus to others. So when we say please mitigate the impact, we're not only referring to the population that have been typically most affected by COVID-19 so far. We continue to support all the states in the response. The team has just been deployed to Akwa Ibom to support our colleagues working very hard. The colleagues in Akwa Ibom State really deserve a lot of credit for the work they've done over the last few months, especially the last few weeks, detecting clusters. These cases are really spread across the state, so they're not located in one place alone. But really credit to the excellent team working in Akwa Ibom State, responding to the outbreak at the moment. To divert a little bit, colleagues would have seen that in addition to COVID, we've been challenged by a large cholera outbreak in many states in the country. We continue to work in response. Together again with our colleagues in NPACDA, we're about to start a vaccination campaign in Bauchi State, where we had one of the most severe outbreaks. But vaccination will not solve the cholera problem. Cholera is a disease of water, sanitation, and hygiene. And as long as we don't address those fundamental issues, we will not get ahead of cholera. So we're going to work very intensively with states to really rethink the ecosystem that leads to people developing cholera in Nigeria, and try as much as possible to demedicalize the assumption that response by vaccines or oral rehydration fluids will solve the problem. We need to go back to the very basics to address the challenges that cholera continues to place on us in Nigeria almost every year. Finally, a few words of hope. We've been responding to this outbreak now for close to 2 years. And as much as I've announced in the beginning that we're at the beginning of a third wave, we know a lot more than we did 18 months ago. We know a lot more on the response side, but we also know a lot more as citizens. So our responsibility now is to use our collective knowledge to respond to the challenges that we are facing. And really, for each of us to deliver on what we now know that works, take responsibility for the actions that we need to do, and make sure we actually deliver on the response at the federal, state, local levels, but also at the level of every leader, whether you're leading a church, an organization, or whatever group of people come together. At NCDC last week, we called together our colleagues to learn the lessons from the outbreak in our annual conference, and with the support from the Africa CDC, who was represented by the director of the West Africa Health Organization, the chief scientist of the World Health Organization's colleagues from US CDC, we deliberated on the response so far, the lessons that we have learned, and we committed ourselves to making sure that we learn from those lessons and continue working very hard to protect the health of all Nigerians. So to conclude, even though the third wave is on us, there are a few other things that are on us as well. We've seen political activities increase across the country. All of these lead to gatherings. The politics in itself is not the problem. The problem is the gatherings of people that then escalate to further transmission of the virus. So please, as we engage in these activities or all the other activities that tend to happen as we get to the second half of the year, we can't wish away the fact that we're in the middle of this pandemic. We have to learn to live with this at the moment until we can get ahead of it. It means that there will still be a lot of sacrifices that are needed in our organizations, in our jobs, in wherever we gather. And we need to really avoid a situation we have seen in many countries where the entire health system collapsed from the force of infection. So we keep saying the same thing, and we have to keep encouraging each other to do the very hard things that we need to do to mitigate the impact of this virus. But we've learned a lot over the last 1.5 years. Now is the time to implement all those measures that we've learned and to make sure that we keep our country safe. Thank you.
The chairman of the Presidential Steering Committee and Secretary to the Government of the Federation, honorable ministers here present, Deputy Ambassador of the United States, Head of Mission, colleagues, country representatives, distinguished ladies and gentlemen, permit me to raise an already established protocol. Permit me to start by once again expressing our profound appreciation to all Nigerians and indeed friends of Nigeria for the support we received during the first phase of our strategic COVID-19 vaccination rollout, which officially ended a few weeks ago. As you are already aware, yesterday we received 4,080,000 doses of Moderna COVID-19 vaccine from the United States government, donated through the COVAX facility. Before the arrival of these vaccines, the federal government had proactively procured 60 units of ultra-cold chain equipment, out of which 37 have already been deployed to the 36 states and the Federal Capital Territory. We have experimented and verified our ultra-cold chain facilities are capable of storing COVID-19 vaccines that require temperatures of below -40 degrees Celsius to -80 degrees Celsius. The vaccines will be deployed to the states as soon as we receive clearance from NAFDAC. This is in line with standard practice. When the vaccines arrived in the early hours of Sunday, NAFDAC officials were on ground and they randomly collected some of the samples for testing to certify if they are fit for use in Nigeria. Once we receive NAFDAC clearance, which should be in a couple days, we will commence distribution to the states that are already on standby. Like the Oxford AstraZeneca vaccine, the Moderna vaccine requires 2 doses, which should be taken at 4 weeks interval. We strongly advise Nigerians who are eligible for vaccination to come out and get vaccinated and ensure that they follow the vaccination schedule in taking their second doses when they are due. The Moderna vaccine has been proven to be effective in preventing severe form of COVID-19 after the second dose. It is also, from some studies, 74 to 94% effective against the Delta variant of COVID-19 virus. While Moderna and AstraZeneca vaccine do the same job of preventing severe COVID-19 and death, we advise that people should avoid taking the vaccines one after the other. In other words, those who have taken AstraZeneca as first dose should also take AstraZeneca as the second dose. And those who will take Moderna as the first dose should take Moderna as second dose when due. We're engaging with the World Health Organization and the SAGE to look at the new recommendations around AstraZeneca and Pfizer vaccination. On this note, it is important to inform you that the next batch of AstraZeneca vaccines will be arriving within the next couple of weeks and will be dedicated to second dose administration.
This is to ensure that those who have taken their first dose are provided with the same vaccine for their second doses. To improve utilization and minimize challenges in our electronic management of information data, the EMIT platform, we have developed a mobile app that can be downloaded by anyone from the Android or Apple store. The app contains verification auto site, which enables clients to verify their records within 24 hours, and an effective troubleshooting platform. With this app, clients can register and receive SMS and email confirmation efficiently. We plan to launch this on Thursday this week. We had previously informed you that we'll be adopting the whole of family approach to integrate COVID-19 vaccination with other basic primary healthcare services, such as childhood vaccination, screening for hypertension, and other non-communicable diseases. This will ensure that while protecting eligible Nigerians against COVID-19, we are also concerned about the total health of the individual and the entire family. This will further enhance the acceptability of COVID-19 vaccines, because we're taking into consideration that it is not only COVID-19 that is a health challenge in Nigeria, so we're using the platform and the focus on COVID-19 to also address other health issues within the community. Like I mentioned in our earlier briefings, we have assurances of the delivery of 698,880 doses of the AstraZeneca vaccine within the next 2 weeks, and also 3,924,000 doses of the Oxford AstraZeneca vaccine later this month. This will again go towards vaccinating those who have not had their second doses, and then give an opportunity for others to take their first and second doses. We recognize the fact that Nigeria could not have been successful in fully utilizing the 4 million doses of AstraZeneca vaccines we received from the COVAX facility in the first phase without the support of the media. As we continue to appreciate this, let us be mindful that the current phase of the vaccination, the second phase, would require increased delivery of responsibility and commitment from the media. We need to double our efforts in confronting misinformation, disinformation, and educating Nigerians on the need to get vaccinated against COVID-19. We are aware that some concerns may be raised around which of the vaccine brand is best and who is eligible to take which. Let me be clear that all the vaccines we receive in Nigeria are safe and effective in providing protection against COVID-19, inclusive of the Delta variant. No vaccine is superior to the other. They only have different manufacturers, but all of them will deliver protection against COVID-19 to anyone who is vaccinated, especially severe forms of COVID-19. Anyone who is 18 years and above and has not been vaccinated is eligible to take any of the vaccines in the recommended doses. On this note, I would like to call on all eligible persons in the country to register and go to the nearest designated health facility for vaccination against COVID-19. The government is committed to providing safe and effective COVID-19 vaccination and ensuring that all eligible persons in Nigeria are vaccinated. Let me remind us that the detection of the Delta variant of COVID-19 virus in Nigeria underscores the need to continue to observe non-pharmaceutical preventive measures such as wearing of face masks, social distancing, and hand hygiene to curb the transmission of the disease. We cannot overemphasize the use of these public health measures. In conclusion, I would like to thank the state and local governments, our partners, our donors, traditional and religious leaders, and all our dedicated frontline health workers who made it possible for us to fully utilize the vaccines in the first phase and all the preparations that have gone into rolling out the second phase of the vaccination. I thank you for listening.
We would now move on to the next phase, where the Honourable Minister of Foreign Affairs moves in. He would give his technical report. Let's now take your questions. Are we ready with your questions? Question one. Come on, take it. Okay. Nigerian, NTA.
Good evening, Chairman and members of the PSC. My name is Mitaire Ikwen. I report for the NTA. Nigerians who have taken complete doses of the COVID-19 vaccines here in the country with certification are still subjected to receiving vaccination outside the country, or they will be quarantined. We want to ask, why is this so? And because that action alone seemed to cast aspersion on the vaccines being taken in the country. And is Nigeria taking this up diplomatically, or are we going to apply reciprocity to such countries like the United Kingdom? Thank you.
Good afternoon, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the Director, CDC. Sometimes in June, the US CDC was investigating a potential real side effect from COVID-19 Modella for inflammation of heart, muscles called thank you. And also, there were reports for people that had dermal fillers experiencing swelling on their faces, all from side effect of Moderna vaccine. So the investigation, we're yet to get the results from that particular investigation. So will you be advising Nigerians to go ahead to vaccinate people from the age of 30 below? Thank you very much. My next question is for the DG NCDC. So we have seen ongoing transmission of the Delta variant in countries that have vaccinated large part of their population. Is the DG worried of the impact of new variants on the effectiveness of the country's vaccine? Again, DG, congratulations for an excellent work you and your team did for sequencing the Akwa Ibom samples so quickly. It was quick. Have you found the Delta variant in Lagos? And why are we not sequencing more samples from Lagos to see? My last question is for the primary healthcare EES. Earlier today, even though you just corrected yourself, you said that the vaccine received samples were with NAFDAC. And you said NAFDAC were going to carry out evaluation, you said, you made mention of NAFDAC was going to carry on, you just said assessment here, but you said efficacy or potential something. So now, you just made mention of NAFDAC is going to take assessment. We would like to know what kind of assessment or efficacy it's been carried in the period of 48 hours. I'm not a scientist, but at least I know small. Then, or is NAFDAC going to carry a vacuum or vaccine vibe? So just explain to us what that means. And again, sir, the vaccine uptake is on. I don't know how you've been managing situation of electricity in those remote areas. So you tell us what you'll be doing differently. Now for the SDF, sir. So people will say we are facing, this is a national thing, so it's meant to be a national response. But you find out that some states are taking their samples outside the country for sequencing. You just made mention that we have 140-something machines across Nigeria, but we are still going out of the country to do sequencing. I don't know if that is right. I really want to know your relationship with the state government in fighting this vaccine, since some states are doing well while other states are doing real badly. So help us to clarify this. Thank you very much.
Good evening, sirs. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. Dr. Faisal Shaibu, Nigerians that are enthusiasts, those are willing to take vaccines, have already taken. Those remaining are the one resistant vaccines. With this arrival of this batch of Moderna vaccines, what are you going to do new to convince Nigerians that this is the only way out of COVID-19? SDF, sir, with the arrival of this Delta variant, are you contemplating another lockdown? Thank you very much.
Thank you for those questions from my colleagues. Let's now return to having one more technical report as we invite the Honorable Minister of Foreign Affairs. You have a floor.
Thank you very much. Apologies, I had a very urgent call from a foreign country. So just to brief you on the situation with regards to diplomats, and of course talking about diplomats, I'd like to extend our profound gratitude to the US government for this very generous and very helpful donation to the country. So thank you very, very much indeed for that. Now there are two categories. We had some issues with diplomats at ports of entry, and it was really important. The Presidential Standing Committee decided that we had to come up with something that was clear, that everybody could understand, all the diplomats, and not have the difficult situation that we were having. So basically, there are two categories of countries, as you know. They're the restricted countries, 4 countries that are under a restricted protocol, and other countries. Now, regarding diplomats coming from the restricted countries, or that have visited or passed through those restricted countries in the last 14 days, there's a special protocol that we have in place. Now, so of course everybody has to do a PCR test, before traveling 72 hours before. But for non-restricted countries, the diplomats coming from those countries just have to have that 72 hours prior PCR test, and then within 7 days do a test in any accredited private laboratory. If they have no PCR test taken, a valid PCR test, then they would have to be quarantined in government facilities. But if they do have a PCR test, they still have to do a 7-day self-isolation at their residence. And if they do test positive for diplomats, and it's a mild condition, they can isolate at home. And if it's moderate to severe, then they have to be in accredited hospital facilities. Now, for those diplomats coming from non-restricted countries, they can get special waivers from the 7-day isolation. And this will be applicable or available to high-profile diplomats. And so if, for instance, they're coming to meet with the president or the vice president, then they would be they'll qualify for a 7-day isolation. Then the others would now be decided on an ad hoc basis as to whether they would benefit from that waiver. So that's in respect of diplomats coming from non-restricted countries. Now, diplomats coming from non-restricted countries, sorry, yeah. Then diplomats coming from any of those four restricted countries, or have visited any of those four restricted countries within the last 14 days, there's a possibility of a waiver for them to very essential personnel on special recommendation, Ministry of Foreign Affairs. But nevertheless, with that waiver, they would still need to be screened at the airport, before entering into the country. And those waivers can only be given by the Presidential Steering Committee. I had said Standing Committee before. Presidential Steering Committee can only issue the waivers that will be shown at the ports of entry. And now, this is a catch, and this is what has caused a little bit of some issues in the past. Now, all diplomats coming from any of those four countries within the last 14 days have to, we're afraid, quarantine in approved government facilities. And the only exemption or waiver from this would be for the ambassador of a particular country and his or her spouse and the deputy ambassador, but alone. So only those three categories of diplomats can get an exemption not to isolate. They'll still have to isolate in their private residence or whatever, but not have to isolate in government-approved facilities. And in those cases, they have to do tests on the second day after arrival, and also 7 days on the 7th day after arrival. But we did a briefing for all the diplomats and went through in greater detail, and to make it absolutely clear. And we've just finalized the text, the regulations, and we will be making that, circulating that to all the missions and also to our missions around the world to share with their host governments. So that's the situation. Thank you very much.
Good evening. My name is Juliana Tawa Baloyan of the Sun newspapers. Two quick clarification. One, which of the states has the highest case of Delta variant? The SGF said Lagos has 50, and NCDC is saying, yes, 50%, and then the NCDC is saying 80%. So we need that clarification. Secondly, I heard the NCDC DG said that we are now officially experiencing third wave of COVID-19. Is that what it is, please? I need to be clear. Thank you.
Thank you for those questions. We'll now invite responses from Honorable Minister of Health. Let's start from you.
Well, I'll just respond generally to the questions. That is that Lagos has more than half of all these cases, and the specific number, well, that is a matter of detail. And as far as the question of whether we are officially in the third wave, it's not something that starts at once. It starts gradually. It is insidious. So we're beginning to see an increase in the number of cases that we used to see. We are doing about 500 cases now, whereas it used to be much less than that. So we are obviously looking at other countries around us. We see that it started in East Africa, in Kenya, Uganda, South Africa, and then Congo then began to appear in West Africa, in Ghana, Senegal, and now it's beginning to enter Liberia and Gambia and so on. So all of us are seeing gradual increases. The Director General of the West African Health Organization was with us this morning. We also confirmed that it is entering the region. So you cannot give it an exact start date, and by the time you start doing sequencing, more genomic sequencing, to identify the exact sequence of the virus, you will be not very sure whether it's Delta, but it looks as it's going to be, because the virus has been identified in at least 13 cases here. But we have not yet sequenced enough or received the results of enough sequencing to be quite sure that, yes, the Delta virus is responsible for all this increase. For example, somebody raised the question whether, okay, is this increase we are seeing not connected to some activities I had recently, some public activities around holidays, and there was a cleric that had a funeral for a cleric. Are they connected? These are all scientific ways of asking questions and seeing how this one really connects. But evidence looks like it is the third wave because it's regional, and then what we haven't got enough sequences yet to be 100% sure. But clinically, we are still okay. We are not seeing more and more people losing their lives yet. We are not seeing more people getting more sick. The bed occupancy is not skyrocketing, although in some areas there are more admissions. In Lagos, for example, but on the average, it's not out of our power. The health system is still very strong and still able to cope with what we are seeing. What we are doing here is to make sure we take more preventive measures. If we're able to prevent more people from being sick, if we're able to hold this virus at a particular level, then our health system will not be threatened. In that case, we will have overcome the Delta variant more easily than other countries. Because right now, it is not so much how strong your health system is, but how well your system can cope with the attack of the virus. And if you can cope well, you are fine. But generally, you continue to strengthen your health system. We are having more oxygen, about 70 or more oxygen plants coming up, improving more ventilators. We are training more people. We are training people for intensive care. We are training people in surveillance, in sample collection. We are looking at our strategies to improve everything so that we are more prepared. We also do a lot of examination of testing of visitors to reduce importation. We are doing land border testing. We are doing testing even at seaports. We have found 5 cases among seafarers in the Delta region. We have found even at the land border, we found at least 3 cases. So we're checking everywhere to reduce importation and also to reduce transmission so that the problems arising from all of this will be less for the health system. So that's the general approach we take.
So thanks a lot for those questions. Rachel, I think you asked, the first question was the impact of increasing numbers of the Delta variant that we're finding and whether there's any impact on the effectiveness of vaccines. You know, when we talk about effectiveness of vaccines, we always have to think effectiveness against what? What are we trying to prevent? So the most important thing we're trying to prevent are severe illness and ultimately death. And as much as we are dialoguing here about events in Nigeria, really, these issues are bothering everyone across the world. And what is going on now is a very effective coordination of research happening every day with sister national public health institutes across the world. And so far, right now, there have been a few studies that have shown that even with the Delta variant, the vaccine is very effective in preventing severe cases, hospitalizations, and deaths, right? Which is ultimately what we want to achieve. There's been some new data over the last week that transmission might still happen even if you're vaccinated, But to be honest, it's a theoretical construct because, yes, transmission could lead to more cases and ultimately more deaths, but in itself, in that individual patient, if you're vaccinated and you still get the infected, you will not, you're much less likely to have a severe illness. So as much as we're working very hard within the country to prevent cases, the key thing is to also do the diplomacy and the work the federal government is doing to get more vaccines into the country and to then make sure Nigerians take as much of the vaccine as possible. So the message is still, despite the
you take care. We have power to prosecute, to go to court. We have power to convict people. Those people who are doing bad, if you let us know, we'll take care of them. Don't touch, don't touch.
It's fake.
Don't touch, don't touch.
It's bad.
Don't touch, don't touch.
It hurts.
Don't touch, don't touch.
It destroys.
Don't touch, don't touch.
It kills.
You should know where to go. The SON.
If you continue to produce substandard steel bar in Nigeria, we will expose you, fine for doing so, and prosecute you. Director General of the Standards Organization of Nigeria, Malam Farouk Salim, tells manufacturers and stakeholders in the industry when he met with them in Lagos. Director General of the SON urges the media to be thorough in the coverage of the agency's activity to ensure that consumers are well informed to make the right choices. The program you're watching is Standard and You, your guide to product quality and safety. It comes to you every Mondays on Africa's largest television network, the NTA. 6:30 p.m. is our transmission time. Nice to have you join us on the program. My name is Ifenyua Okonkwo. Sit back, relax, and we will take you through the world of standard. I'll be back shortly.
I want a situation where in the future, when you see a son person, either in your market or in your shop or on the street, you bring him close to you and say, welcome, come, beer, let's talk. Because it's your brother, it's your friend. But I cannot be your brother if you don't know I'm interested in protecting you. Like they say, on your son, with Rando.
Welcome to the world of standard and quality, where we offer you information on product safety and quality. The program is Standard and You.
Choose life and live. Buy original. Be original. SON.
Welcome back. Thanks for joining us on the program. Stiffer sanctions await importers and manufacturers who still engage in the production and distribution of substandard steel bars in the country. The Director General of the SON says anyone caught will be severely dealt with in accordance with the provisions of the law. He gave this warning at the meeting with stakeholders at the expiration of the 3-month ultimatum to manufacturers in Lagos. I was there for Standard and You.
Exactly 3 months ago, the SON boss met with manufacturers and importers of steel bar in the country. At that meeting, he was emphatic when he gave them a clear warning to desist from the act of producing substandard steel bar. He lamented the devastating effect such bad product has had on the economy and frowned at the situation and appealed to the manufacturers to embrace standard.
We just want to assure people that it's a fair warning that if something like this keeps happening, we are going to prosecute the individuals. We are going to give notice that in 3 months' time, we are going to do an enforcement, a market survey. Every person, distributor who happens to be possession of substandard goods will have a fair warning of 3 months from now to either get rid of it or make sure you don't buy anymore, after which we are not going to tolerate any of that stuff in the market.
This meeting is in furtherance to his last engagement with the stakeholders at the expiration of the 3 months ultimatum. It was observed that some of the manufacturers had complied, while 3 others are still in the business of producing substandard iron rod. This time, the DG is not just sounding a note of warning, but has declared total war against anyone compromising on the quality of steel bar. Anyone caught is stressed will be exposed and prosecuted.
Our intentions are not to cause problems for the industry. But if we happen to have an inspection and the product is below standard, the least we can do is to have you put it back in the furnace and produce a better standard product. I have no problems melting 1,000 tons of steel if they are below standard. If my employees have to stay in your manufacturing facility for a week so that this is accomplished, we will do it. We will fine you, and you pay money directly to the government, not to us, not to me, not to anybody else. If it becomes a problem, I promise you, we will prosecute, because this is a life and death issue. We have buildings collapsing in this country, people dying in this country because of other problems in addition to steel problems. So it's a very serious issue. I'm very proud and happy with you so far for the compliance, and you will find me to be your best advocate. I will work with you, make sure things are done the way you want them to be done. I will be your partner, I'll be your friend. But if we have issues, we will not be friends. Mr. X steel industry was found with 100 tons of substandard steel, or Mr. B industry was found with an unmarked steel. We will not only have our evidence, but we'll have the cameras show the evidence. We'll make sure your customers are aware that we were there and we found you guilty of those infractions, and we'll make sure everybody carries it so that people know. That way, everybody understands that it's not profitable to break the rules.
He said the SON will continue to develop capacity by deepening its quality infrastructure to check the activities of such unpatriotic and selfish manufacturer who would always want to deny consumers value for their money. The SON, he disclosed, is more than ever ready, equipped and committed to protecting innocent consumers of goods, and will stop at nothing to perform its statutory obligation to Nigerians.
The federal government of Nigeria is not going to sit idly to have our citizens exposed to danger because of individuals' need to make profit. We will not penalize any industry that is doing the right thing, but we are not going to look the other way to any industry that are not doing what they're supposed to do. When we see products that are below standards, we'll do one of two things. Put them back in the foundry, and then you reuse it again, or we prosecute. We have the legal power to go to court. We have the legal power to take every individual organization or company, no matter how big or no matter how small, to court.
The manufacturers assured the DG of their determination to adhere to standards, but asked the SON boss to also check the activities of importers who smuggle substandard iron rods into the markets and expose products of genuine manufacturers to unfair competition.
Last time that we had a meeting, we agreed on some parameters, And happily enough, if you listen very well, we found that the DG did mention that there's a lot of improvement in the market. And we've also sensitized our members to continue to improve on the quality. And of course, there's nothing stopping us from increasing the quality or maintaining the quality. But then, as we said earlier on, that the activities of smugglers, at times, the smugglers are tarnishing our image. Because not only are they competing against us in terms of producing substandard, they also pirate our names. They corrupt our names at times. Where we put K, they can put C. Where we put African, they can put international, just to mimic what we are doing. And that's what we mentioned at the meeting, that SON should actually put more torchlight on the activities of smugglers, so that they don't come in here and pollute the market for us.
The DG urged the manufacturers to work together as an association and share information that will help stem the tide of substandard iron rod in Nigeria.
Wow, Chief Mike, how are you? Fine. I'm going to Sun office for the certification of my wheat flour.
Oh no, things have changed. Sun has simplified all its activities. You could have even stayed back in Kano and process all your papers online.
Whoa.
With the efforts of Sun, the products of SMEs can now compete globally. Sun has put in place necessary machineries in support of the growth of SMEs. At highly subsidized charges, SMEs can now get their certification, laboratory testing of their products, as well as purchase of standards. Meanwhile, Sun is carrying out massive seizure of substandard goods in the market and have gotten legal backing to prosecute offenders, all to protect consumers and SMEs.
Sun, improving life through standards.
You're still watching Standard and your guide to product quality and safety. The Director General of the Standards Organization of Nigeria, Malam Farouk Salim, has urged the media to be thorough in their coverage of the SON activities to ensure that consumers are adequately informed to make the right choices. The DG SON gave this advice at an interactive forum between officials of the agency and representatives of some media organizations in Lagos. Alimoto Sifo was there for Standard and You.
These are members of the fourth estate of the realm from the various media organizations in the country. For almost 3 hours, these gentlemen of the press from the electronic, print, and social media were sensitized on the activities of the Standards Organization of Nigeria. One after the other, head of critical departments of the SON took turns to educate the gathering on the services of the agency. The whole idea of the exercise, according to the SON boss, Malam Farouk Salim, is to help journalists make sense of the activities of the SON and deepen their knowledge on the mandate of the agency.
As an organization, we know the weight of our responsibility, and it's a job of the journalist